Welcome to the Living Medicine podcast, where we talk about ethical medical use of psychedelic psychotherapy, teaching skills, examining the issues, and interviewing interesting people. Now let's start today's show.
Hello, it's Dr. Sandy Newis, your host for Living Medicine, where I interview mental health and medical professionals who break down the evolving ketamine and psychedelic-assisted psychotherapy space. Recent interviews that we've done have been with Dr. Ron Siegel, Dr. Dick Schwartz, and Dr. Michael and Annie Mithofer. We encourage you to check those out, as well as others that are on our YouTube channel. This episode is brought to you by Living Medicine Institute, a training, content, and resource hub for the psychedelic-assisted psychotherapy community. For more information, please go to livingmedicineinstitute.com. So I have Chad here from Rise 25. He's done thousands of interviews with successful entrepreneurs and CEOs, and we have flipped the script, and he's going to be interviewing me today. So welcome, Chad, and we really appreciate this.
Hey, it's great to be here. Thanks so much, Dr. Sandy. I'm looking forward to talking with you today. Why don't we just kind of dive right into it? Tell me, what is psychedelic-assisted psychotherapy, and how does it differ from kind of maybe the traditional therapy that most people are used to or have heard of?
Great. So psychedelic-assisted psychotherapy kind of has a lot of different meanings, a lot of different contexts. So I really want to specifically focus this to a clinical and a medical context. And what that means is the first big difference is that it's medically supervised and that it is run by a licensed psychotherapist. So, people have therapeutic experiences in other contexts. What that means is they might have big aha moments or things that really change their life, but that is not psychedelic-assisted psychotherapy. Okay, so we've got clinical and medical supervision and oversight and involvement. And psychedelic-assisted psychotherapy is really it's more like a therapy process, a traditional therapy process than not, where we actually embed the psychedelic experience. That might be ketamine, which is legal, and that is primarily what we focus on now, really for that reason, as well as the fact that ketamine is really potent and very powerful and fits easily into that context. But it may also include things that are emerging as potentially approved for therapeutic use, such as MDMA, Psilocybin, LSD, or ibogaine, as part of an established psychotherapy program. And what that means is that we've got all of the different elements of that. So we've got intake, we've got assessment, we've got preparation, we've got integration, and preparation and integration look a lot like a traditional psychotherapy process. And the medicine session is embedded within that. So the medicine session is actually a part of the process, but it is not the process. And that is one of the common misconceptions, that it's all about the medicine.
So speaking of possible misconceptions, maybe people might think this is some new fad or something like that. How long has this psychedelic assisted therapy been researched?
So awareness of psychedelics as potentially having profound therapeutic effects really began to emerge in the 50s. And so kind of throughout the 50s and the 60s, maybe even into the early 70s, I don't know exactly when the prohibition happened, but there was a developing body of well-controlled research, scientific research, that was really showing very marked impacts for well-entrenched mental health issues, depression, anxiety. There were studies done on alcoholism and other forms of addiction, and they were run at reputable institutions. Harvard had a program. I think Johns Hopkins had a program. Like, it wasn't fringe at all. They were well-established academics and scientists who were really excited about the profound effect that these medicines could have on people's mental health and well-being. And then what happened is kind of a combination of cultural factors, regulatory factors, governmental factors, ultimately led to that being shut down. And all of the psychedelics were put on a scheduled restriction, which meant that it was at the highest level of scheduled restriction, that it had absolutely no clinical or medical utility, and therefore research was not allowed. And that really went on until the 90s, when Rick Doblin and the MAPS group, Michael and Annie Mithofer, became involved, and they worked really, really hard to begin to chip away at that, to craft well-designed research proposals to try to get the FDA to allow at least research. And so MDMA research ultimately is what began to open the door. And they did such well-controlled research that they were able to run 3 rounds of clinical trials, which ultimately opened up the door for research in other medicines that have been done at such institutions as, again, Harvard and McLean Hospital and Johns Hopkins. So there is an emerging body of extraordinarily well-controlled research that is really driving this. And there have been some recent bumps in the road kind of about that with the FDA. That might be a separate talk. But that science is very well established, and it's going to continue to grow. So really, this is a movement in a major shift in mental health that's being actually driven by the science. And that's super important for people to understand.
Yeah, and and as you mentioned, it really has some history to it. Maybe even it even has some cultural roots or some historical roots. Can you kind of explain how those relate to the use of psychedelics for healing?
Sure. I mean, first is to embed psychedelic experiences within the broader expanse of non-ordinary states of consciousness. So plant medicines, other forms of medicine really take place within the context of mindfulness, ceremony and ritual, nature connection. There is a variety of different activities that humanity has been engaging in for all of recorded history, thousands and thousands of years, to shift consciousness and to affect change through that, affect change at the community level, at the individual level, at the physiological level, medicine, ceremony, and ritual. And indigenous people and people in different contexts have been using medicines to introduce non-ordinary states of consciousness in a more direct way for as long as we are aware of. So this is not a new thing. In fact, there are more parts of the world that actively engage in this than that don't.
Oh, really? Interesting.
Yeah, I mean, it's really found worldwide in communities worldwide. Again, non-ordinary states of consciousness and medicines that help induce that is, as old as humanity, right? To be
So,
able to use those to affect change. So we're really just revisiting ancient wisdom, and what that means to help humans get out of the kind of default mode of functioning and explore consciousness in a different way.
so you mentioned earlier that you use primarily ketamine. Is that right?
Yep, that's what we use at our clinic. Again, there are a variety of different reasons, but one just being that it's the only thing that's legal. There are different states now that have different legalities moving specifically with psilocybin. But ketamine has never been illegal. It's very, very safe. It comes out of the ER. They use it like, we had a trainee say we use it like water in the ER. It's extraordinarily safe. It's on the UN list of necessary medications. So it's not illegal and it's never been illegal. And so we focus now on that. We have a training program, which I think we'll mention, but the skills that we use there are applicable to all forms of medicine. So it's not just specific to ketamine. But yeah, that's what we use. We've also got a lot of data to show that it works. And we've got anecdotal data that we use with ketamine-assisted psychotherapy showing that we're having really significant effects.
So, in what ways would you say it's beneficial for psychotherapy? Like, how does it work?
Well, I mean, I think that as I mentioned, putting it kind of in the context of a therapeutic sort of course of treatment is important.
Mhm.
Although with ketamine, there are really 2 tracks. There's ketamine treatment alone, where there is no therapist, and we actually do that as well. That is medically supervised, where people are doing that kind of in collaboration with the physician. There is also at-home use of ketamine. That's really controversial. And it's not necessarily something that we support, although it does give ease of access because it's more affordable. So once again, kind of a separate conversation there. But the 2 tracks, ketamine treatment and ketamine-assisted psychotherapy, with ketamine treatment, really the ketamine itself really is the primary focus. So people come in often for what are called infusion series, which is 6 sessions over 3 to 4 weeks, used primarily originally for treatment-resistant depression. But as those of us in the clinical world know, treatment-resistant depression is often just the tip of the iceberg. Underneath that is often anxiety, developmental trauma, chronic stress that's leading to more of a kind of a frozen, depressed presentation. And then there's also the ketamine-assisted psychotherapy track, which is, again, as I mentioned, where it's embedded within the therapeutic, like a whole course of therapeutic intervention, and the medicine becomes one part of that. Um, but what it really does is that one of the kind of popular terms these days is the default mode network. And that really explains that. It really puts people into an altered state of consciousness, and it takes the default mode, which is just your like general everyday way of being and your way of interpreting the world, and it kind of puts it aside. So it really allows different material to emerge, different imagery, different realizations, different thoughts. We kind of talk about the triangle, the thoughts, the emotions, and the body. It allows for a different experience on all of these levels. We have a very strong belief in the subconscious and that what is often referred to as inner healing intelligence in the psychedelic world. And that kind of takes away these defensive holds on it. And it also really allows those parts of oneself to emerge. And then what we do as clinicians is our job is to track that. Our job is to be able to be mindful of that and to notice what's actively emerging. So during that time, I'm actively taking notes. And then my job at integration about the content that comes up for the client. And then during integration, we revisit that, we embed that within their treatment goals. We help them understand and make sense of that, ultimately with the goal being, how does this impact the rest of their life? So, yeah. So ultimately, one more piece of that equation is really, I work a lot with trauma. And one of the terminologies in trauma is body armoring. So your body kind of holds and tightens against it, right? So against the difficult things, against the difficult material, against the different things that are happening. And what I think really happens with ketamine is just this profound softening. So the body softens, the sense of self kind of shifts, the mind opens, the emotions flow more freely. And that just allows kind of a more naturally occurring, less defensively held process that gives us access to things that we just never can get to in traditional psychotherapy, or that might take years.
Yeah, I know trauma is one of your specialties. Is there anything else you wanted to touch on regarding that?
Yeah, I think, one of the things that's really interesting is when you read the ketamine literature in specific. MDMA has been launched as treatment for trauma. So it started off as kind of event specific traumas and, first responder and veteran type traumas that are kind of more commonly experienced, and then has moved into developmental trauma. And the earlier literature in ketamine, again, specifically focused on ketamine treatment as opposed to ketamine-assisted psychotherapy, they're very different, said that ketamine wasn't good for trauma. And there's still lots of people who hold that. And I do believe that if you just go to ketamine treatment and you don't have the therapeutic support, that it might not help. I don't know if it might make things worse. We occasionally see people who, things emerged and they didn't have any way to process it. They didn't have any way to integrate it. They didn't have, therapeutic support to help them work through it. And so that makes sense that people are struggling with that. But when you put in with a trained clinician who really works with trauma, who knows what they're doing, and who also knows how to work with ketamine, at that point, we have a really beautiful opportunity to do this work. So the medicine allows us access to content. It allows us access to memories. It allows us access, again, to the emotions and the physiological ways that show up in a way that's more direct. And because the client is in that softer, less defended state. So for me, what I do very specifically is I follow really very similar protocols as I use when I work with clients in non-medicine sessions.
Mm-hmm.
So I teach skills, I teach resource, which is the ability to access well-being within the body, within the psyche, to be able to shift out of that traumatized state. So we talk about fight, flight, freeze mode, where our nervous system goes into that and it distorts our perceptions, and we see the world through that, and we put that state onto the world. So that's really the essence of a more neurobiologically based approach to working with trauma. And when we work with ketamine, so I do an extensive developmental history, And then I establish treatment goals. And I teach skills, how to connect to the body. And I also teach some frameworks and some ways of understanding how state is really important. And it's not just about content. So content is the what happened. So, and that is one thing when there's been like a specific event, like maybe an accident or some kind of really traumatic event that somebody can identify. That's referred to as index event. But another big piece of working with trauma, particularly developmental trauma, which is early relational issues and struggles where somebody feels unsafe in their world, is that it's about state. So this state of activation, that state of being in that fight, flight, freeze mode. And then the way going through life in that state impacts our perceptions of things. It impacts our reactions to things. It impacts our capacity to have relationships, interact with self, world, and others. And so what we're really doing is working with that state and helping to shift that state, providing skills and opportunities in order to do so with the medicine to experience the shift in state, and then to help them apply that to the rest of their lives. So when I say shift in state, I don't mean the actual like altered state of being quote unquote high. What I mean is the shift of state into more well-being, into being able to be more emotionally connected, into being more emotionally connected to self or others, and then to be able to be in that state as we move through our lives outside of the medicine session. So it's really not what people think. It's not all about like getting to the root and processing that moment. It might be, but it's really also about that overall shift in state.
So let's say I, having not experienced this before, I came into your clinic and was just interested in kind of the typical treatment process. What would that look like?
Good. So it looks like that it depends on if you're coming in for ketamine-assisted psychotherapy, you might contact me or one of the other clinicians on our team or the clinic first. So we work together, but we are kind of separate entities. And so the kind of critical pieces are you come into the clinic for an intake. So an intake means that you meet with our medical team, one or more of our medical team, sometimes for an hour or more. And that's one of the things that's not all the clinics do that. So there's the medical screen piece, and then there's really taking of the history. And in the process, there's rapport building, developing a relationship. It's of critical importance that if anybody goes to do ketamine work at a clinic, that they feel comfortable with the clinic and they feel comfortable with the provider, because that setting, that mindset, set and setting are important variables. That feeling of comfort in the setting and the mindset that you go into from a place of trust and feeling hopeful that this might help and that you can really trust, you can allow yourself to drop into the experience is just critical. So that's the medical side of it. And then on the therapeutic side, most providers do 2 to 5 preparation sessions in advance, sometimes more. My average is 4. I generally do 3 to 5. And so we're going to do that before the medicine session. And then we'll do the medicine session. And then we'll do integration with 24 to 48 hours is ideal. Really more than 72 and you begin to lose some of that. And in integration, I review the notes that I have with the client to prompt their memory. And we process the different elements of what came up in the session. And then my role is to ground that within the developmental history and hold the treatment goals that they're working on and trying to weave that all together. So where the rubber meets the road again is how does this actually impact their life? How does this change their life? I personally do not prefer to only do one session. That's really more if you're doing more traditional psychotherapy and you want to have one session to try to deepen the process. The majority of what I do is series where I do 3 to 6 sessions with a client over the course of 3 to 4 weeks. That's not always typical. Most people maybe do 1 to 3. But it's emerging more and more because when we have those touch points where we go in, we have it, we do the integration and we go back in, it really allows those gains to deepen and it allows the client to stay more in that shifted state and to really stay more in that state of well-being as they move through their life. And then that becomes their default mode. That becomes their more habitual state.
I think you kind of talked about this a little bit, but so let's say all that sounds good, but I'm having not experienced it. Maybe I'm concerned about safety or something like that. How do you kind of ensure the safety of clients during these psychedelic sessions?
I mean, that's a really great question. So, and it involves a lot of different levels. And so, the first one is medical safety. So, if you go into any sort of clinic, regardless of how much sort of attention they pay to relationship with the patient, we like to think that you can count on the fact that you're going to be held safe. So, if it's an IV clinic, do they know how to put the IVs in? If it's IM, do they know what they're doing on that level? And then there's different levels of monitoring of vital signs. So, at our clinic, they'll take blood pressure before every session. They're tracking, again, they've done the medical history. So they're understanding what your medical history is and what any of the concerns might be. Untreated blood pressure is certainly of concern. High blood pressure, untreated high blood pressure. And they're going to be watching that more carefully. Treated high blood pressure, that's another story. But they'll be taking your vitals. We have a little ring that we put on people's finger, and we're monitoring that and taking their vitals throughout. So we're monitoring heart rate, oxygen saturation, and also then the medical provider is in and out consistently through the session. So I'm sitting with the client, I'm right next to them, we're talking, we're processing throughout, but the medical person is also coming in. They're checking the IV bag, they're checking the drip rate, they're making sure that that the patient is really just is physiologically safe. They're looking at them, they're looking at their distress levels, and they're also getting those impacts from the patient monitoring devices that we use. On this psychological side and the emotional side, as I said, I'm right there with the client. That's kind of one of the misconceptions about psychedelic work, is if we're just kind of sitting quietly while the patient goes inward. And the way that we do it and we recommend is that you're involved with the client. So the client really feels me in their bubble. Like, we are doing this, we are close together, we are connected. And I'm also just monitoring. I'm watching them, I'm with them, I'm talking with them, and I'm watching distress levels. Now, if there's distress level, now we're looking at, is this beneficial? Is this useful? Is this something that is part of their therapeutic process? Or are they more in a state of panic, or even a state of dissociation, which is kind of another one of the misconceptions. Like, ketamine is a dissociative anesthetic, but really we're looking at getting somebody right at the level where we're having the benefits of the softening that can bring, but that they're not so out of it that they're difficult, that they can't engage. So I'm tracking that. When is distress therapeutically useful? When can it be turned into a healing experience? Or when is it that somebody's really more just in a state of panic? And that doesn't happen that often. But if it does, I use my skills, I use my techniques to help ground them, ground them in the present moment. I'll have done some permission already about touch, when I might put my hand on their arm to help ground them in the moment. And with IV, which is what we really like to use, is we can turn off the drip. We can turn off the IV, and they'll begin to sober up in 10 plus minutes. We can slow the drip rate. So we can really slow the rate at which it's coming on. So the patient actually has a lot of control. And then at our clinic, our medical team is trained in emergency medicine. So our founder is an emergency medicine doctor. And so we have all the different types of emergency equipment that one might need. Although we've never needed it. Like, really, just to kind of go back to the beginning, ketamine is actually extraordinarily safe physiologically. And the adverse effects that are reported with ketamine, primarily the people who end up in the ER and other places, are really psychological. And that comes, in my opinion, from a lack of attending to the client, the relationship, the client's therapeutic needs, and the lack of a therapeutic process.
One thing you mentioned earlier was integration. Can you tell me a little bit more about kind of the role that plays in the overall treatment process?
Yeah. So integration, again, is an actual session where I schedule an hour that happens within ideally 24 to 48 hours after the session. So as I mentioned, I take notes throughout the session, and sometimes clients are like, really, what if I say something weird? And that's not relevant. Like, it's my notes and my scribbled handwriting. It goes into their file, but it's not something anybody else is going to ever see. But what it does there is it helps the client to also know that they don't have to track it. Like, they don't have to sit there and try to remember about this important thing that came up. I've got it. So it's really an important part of building that collaboration. And so in integration, we go through not necessarily word for word what is said, but the themes that are emerging. Right? That's one of the skill sets of the therapist, and is to kind of make sense of those themes and to ground that in the client's developmental history. So again, this doesn't just take place in a vacuum. It's not just about the medicine. It's about who the client is, what their developmental history is, what their relational history is, what symptoms they're experiencing, and how they show up for them. And then using the medicine as another window into that. So in integration, we go over the different themes that have emerged. The client themselves begins to make sense of that. I bring my expertise in to kind of sort of start to weave together some of the background history. Um, and then ultimately, how is this relevant? How does this shift your sense of self? How does this help you see yourself differently? But then a really big piece of this that is emerging, and this is also something that isn't commonly seen in the ketamine literature, is really helping clients deepen into their ability to just experience wellness. So I'm also looking for windows into moments when the client's feeling differently, when they're feeling better, when they're feeling more supported, when they might be feeling lighter, they might be experiencing a sense of connectedness or love or oneness, super common in psychedelic experiences. And then we shift into kind of noticing maybe where they feel that in their body or what it's like for them to feel that. And so in integration, I will also revisit some of those things that came up for them, and help them deepen into not only their understanding of the difficult things or the hard things that they're working with, but being able to really just deepen into a more of a felt sense of well-being. So I'll actually work with that in integration a lot. So I might bring somebody back to kind of evoking a moment that was either really powerful for them or that was really meaningful for them, or a time when they felt really good in session. And then we really anchor that in the present moment, in the more ordinary state of consciousness, so that they can kind of carry that with them. So we're also building bridges from the session itself into integration and then into daily life. So integration is a critical part of it. And it's not just all like, tell me what happened, or let's make sense of what happened. It's much more complex and sophisticated than that when you do that in a psychotherapeutic context.
Okay. Well, let's change directions a little bit, kind of. When we first started, you told us that Living Medicine Institute is a training and resource hub for professionals. Tell me, I know that's very important. Tell me a little bit more about that and what that means.
Yeah. So Living Medicine Institute was founded by Dr. Signi Goldman. My business partner and I, she's a psychiatrist. I'm a psychologist. We're based in Asheville. And we initially started providing trainings for clinical and medical professionals who work in the psychedelic-assisted psychotherapy space. Again, we use ketamine because that's what's legal. And so we have in-person trainings. Those are done retreat style. And then we also have online trainings. So they're virtual trainings online. And we emphasize a couple of different things in our training program. We believe that professionals having their own experience with the medicine is critical. So in our retreats, people do 2 medicine sessions back to back with different routes of administration. And in our level 1 clinical intensive, which takes place online, clients actually do 7 medicine sessions throughout. So all 4 different routes of administration. And we do our didactic teaching at the retreat through a video series. So we have a video series that Signi created, actually, that really focuses on the nuts and bolts of the clinical application. So that's kind of the second piece of our training. So we've got, we really emphasize the experiential component, and then we also emphasize clinical application. At this point, what you won't get in our training is a really conceptual overview of the field. We don't really focus on all of the different research and the biological mechanisms of the medicine. Instead, we really focus on clinical application. And so in our retreats, people get the video series in advance, and then the whole emphasis is on experiential. In our level 1 trainings, we work from the video series, we talk about it, we deepen into the clinical applications and the how-tos of how you do it, as well as then using your own experience with the medicine in order to really illuminate that process. We also do, especially in retreat, we do a lot of nature connection, bringing in the natural world. We really believe in, the wisdom of ancient traditions, and connecting to the natural world, grounding within the natural world is really, is a way to do that. So, human and nature really being interconnected, and the natural world is a living being with which we are in relationship with. So that's a big piece of what we do, by just bringing that online and by bringing our awareness more to our environment. So we're kind of grounding ourselves in environment, which is another way to put that. And then that informs all of the different clinical applications, set and setting, the different types of interventions that we use, and ultimately how we work. This is also very trauma informed. So Signi and I both work a great deal with trauma, and trauma informed care really means not just focusing on processing trauma, but creating safety. So we really work on creating a safe, well-held container, which again is modeling for how to work with clients. So in our training, we really only take approximately 12 people to the retreats or the level 1. So we build relationship with us and with each other. We attend to that. And then again, we use that to model set and setting. In level 1, you get access to 4 different routes of administration: IM, IV, intranasal, and sublingual. And in retreat, we do a group intranasal experience, and you can do IV or IM and work with the sitter. So what we think that is unique about what we're doing is, again, that clinical application piece, that emphasis on the medicine, the appreciation of ancient wisdom and wisdom traditions. We don't profess to be experts in that, nor do we profess to follow any particular type of kind of ceremonial lineage, but just an appreciation of the transpersonal elements that naturally emerge for clients, and us as we go through our own training, is really, really important. And we're really invested in building a community. We don't believe that this work can be done alone. So we're building a professional network. We have an online resource hub as well with research, kind of all the trying to be as comprehensive as possible with the research. We have a listing of events. We have a listing of other trainings that are available, and relevant kind of news that is emerging within the space. So that's called the Psychedelic Provider Network currently. That's going to be brought into the Living Medicine Institute. And we're really wanting to just provide resources for professionals at all levels. So medical level, medical, clinical, whether you're just starting or want to commit to a more extensive training program, we want to provide resources as well. So we also have a YouTube channel that has a lot of different things on it, kind of shorter term clinical applications, clinical snippets, different emerging things in the field, as well as interviews with other professionals. So we're excited about it. And yeah.
Okay, sounds great. And people can find out more about all those resources and that training at livingmedicineinstitute.com. Hey,
Yes.
what do you see as kind of the future of psychedelic assisted therapy and mental health treatment?
Well, that's a really interesting question. So, and it's really a changing landscape kind of all the time, because there's a lot of different forces at work here. First, it's not going away. So, this, again, as I mentioned, I believe that it is a cultural change within mental health, and that there has been psychotherapy research, psychotherapy outcome type research that has been done in the field that is really well designed. It's very well controlled, and it's not going away. So it's the first cultural revolution that's been driven by science. And then it also kind of links back to those earlier research. So that's something just really important for people to know, that there might be fluctuations in government and fluctuations in kind of culture and public perception, but that science is really at the foundation of what we're doing. And so, as I said, currently ketamine is legal. I think ketamine is the Wild West. So it's completely unregulated. I mean, meaning a medical prescriber has to get a controlled substance license, but that's it. They don't need to have any additional training. Therapists who want to work in the space don't need to have any training at all. Anybody can do it. Now, again, the upside of that is it might be allow more access. Ketamine clinics are popping up all over the place. This is like competition at its finest. People can offer it at lower price points. What does that look like? But it can also look not awesome, right? So we see a lot of inconsistent outcomes. We have people come to us at our clinic from other clinics where they're not getting good patient care or where they had disturbing experiences. So in the ketamine space, what we'd like to see is that training be required, that clinics go through some kind of accreditation process or some kind of certification process. And so that patients coming in can be assured that at a very base level, the clinic and the providers that they're working with, whether it be therapist or medical, have some basic assumed knowledge and some experience with patient care or supervision, mentoring, and a basic knowledge base. So that's specific to the ketamine space. We'd like to see any of the at-home use really be regulated. So we really stand for regulation, standards, and ethics. Like, we want to see that in this field. And that really goes for the others as well. Right now, there's a regulatory process going on. It's both at the federal level and the state level. The FDA moved to not currently approve MDMA for therapeutic use, which was really disappointing to a lot of people in the space, because here again, the research is really compelling. And just FYI, one of the things that's important is that it was held to research methodology standards for drugs, not psychotherapy outcome research. So those are actually two different sort of methodological approaches to the research. So we think that's still going to happen. It's just going to be a minute. So, and what that's going to look like is unclear in terms of what the FDA might require. But again, it's not going away. Psilocybin is kind of moving through the state level. So it's become legal for therapeutic use in Colorado. Other states have bills on the table to allow for that. So clinics are opening up. And then here again, we want to be really clear that training, certification, some kind of supervision, mentorship, and oversight, that there is a regulatory body for grievance to be called or for ethical violations to be tracked, so that a consumer, a customer, a client can feel trust in where they're going. Then there's other kind of, LSD also has recently been given experimental status for its work with generalized anxiety disorder. 5-MeO-DMT is kind of moving through as profound therapeutic effects, and ibogaine for addiction. So we have lots of movement, lots of things. And then the final piece of this really that's so important is that, and it's also really important to be discerning. So some of the media hype will lead clients to believe, and providers themselves to believe, that it's this one and done thing, that that you go have a session and everything is cured forever. And what is factually true is the more clinically complex the issues, the longer it's going to take and the more skill of the provider is required. So just kind of knowing that going in. So, we need to temper this excitement and this movement and this adoption of these kind of novel and emerging ways of working with mental health, with discernment, with science, with skill, with ethics, with standards. And so that dance is actually really quite interesting. And I think it's really important that those of us in the field really be tracking that, stay involved with that, and really participate in guiding that, so that ultimately we can maximize patient outcomes, because we need better mental health. We need a new approach to mental health in this country, because people are suffering and clients are ready for it, and that's what they want.
Okay, sounds good. Hey, Sandy, it's been great to talk to you today. Thank you so much for all of your time, all your insights, and for having me. I'll hopefully talk to you again some other time soon. Thank you so much.
Sounds great. Thank you so much, Chad. This was great. Appreciate it.
So long, everybody.
Thanks for listening to Living Medicine. We'll see you again next time. Be sure to click subscribe to get future episodes.